Life sometimes come at you fast. Tragedies make your life unravel. You feel like you wanna give up and stay knocked down. Even when your heart is shattered, you still got a life to live. You still got a life to live, so don't give up. We are beautiful miracles. We are beautiful miracles. We are beautiful miracles, so don't give up.
Hello, everyone, and thank you for joining me today on my podcast, Beautiful Tragedy. If you like what you're hearing, would you please like, comment, share, and subscribe? Today, I am joined by Julie Johnson, and she is an instructional designer and content curator at Integrate Trauma Informed Network. So thank you for being here, Julie.
Yeah, happy to be here.
Yes, thank you. I know little bits about trauma-informed care and trauma-informed yoga. So first, would you just kind of tell me a little bit about yourself and your background, how you got into this?
Yeah, that's always a really interesting question, as someone that asks that question a lot to people in our community, in the Integrate community. So, I found my way into this work very, like a lot of people, no shock. I have a history of trauma and complex trauma. Mm-hmm. And, when I was really going through some deep healing of myself about a decade or so ago, I started kind of reading more about, I had really average mental health therapists, I guess you could say, that were just getting me to I was still having panic attacks. I was able to manage my life. I'd had new babies and I was still dealing with a lot of depression, anxiety, and my therapists were good. They were okay, but I was still having panic attacks on the couch and waking up late at night, and I wasn't what is going on? Everything was quote unquote fine. But then I started reading a little bit more, and I'd had a PTSD diagnosis when I was 26, but no one ever really described to me how to care for that. So I was still having panic attacks. I knew I had generalized anxiety. Yeah. So that was just normal, I guess. And I guess that's how I was supposed to deal with my life. And then finally, after my therapist would keep saying, okay, you're fine, you're good. And I would still have panic attacks. And then my husband would have to pull me off a couch to go do normal things. And I was like, this isn't normal for someone that's been in therapy for a long time. We should have a progression, right?
Right.
And so I started doing, this was 2011, 2012. And I finally started reading the Bessel van der Kolk's book, The Body Keeps the Score. And that's when I realized that book was a game changer for me, because that was the answer to my puzzle piece was, I've had CBT for so long and there's nothing wrong with cognitive behavior therapy. Cognitive behavior therapy was my lifeline when when I was pregnant, when I was going through all the transitional things that go with motherhood.
Right.
And then I started realizing, I've been doing all the head work, but it wasn't the body work. This is where the trauma-informed yoga comes in. Mm-hmm. Mm-hmm. And I was like, that's so interesting. So I was if you're not familiar with Bessel van der Kolk, he has a whole thing. So then I read about Bessel van der Kolk and I read about his stuff. And then I was like, I need to be doing all this stuff through trauma-informed yoga. And he goes in his book, he talks about trauma-informed therapy, trauma-informed yoga, trauma-informed systems. Wow. And I was like, wow, we probably all need this.
Yes.
And that's how I got into this. That's the backstory.
Right. I have started to read little pieces of that book, and it's so much that I can only take it in small bits because it's just blows my mind. Mm-hmm. I'm okay, I don't know how you could just sit down and totally read this, because especially when you can identify with it.
Oh yeah.
Yeah. Oh yeah. So how would you even describe trauma-informed care?
That's a really good question. So I'm an educator. I have a background in special ed. And then I have a background in curriculum design and instruction, which is what I work in mostly now, even though they're very similar. Right. It's more of a lateral shift in the same same field. So I mostly do learning development and stuff now. But at the time I was working doing mostly special ed, and I was doing more stuff in under-resourced communities. And I was looking and I was listening to his book, because that was kind of the book that planted the seed for me. And it was really interesting. Trauma-informed care by way of Bessel van der Kolk is looking at things through a non-hierarchical lens. So it's looking at a system of care where, and there is a framework for it, which I'll get into in a second, but it's a whole concept where you're essentially, everything's collaborative between you and your caretakers, or not caretakers, human service providers, which can be a social worker. That's what I say for it's like a lump term for like social worker, yoga teacher, Reiki person, anyone that works with humans in the healing process.
Okay. Right. Okay.
Could be an educator too.
Right. Wow. Okay. So like, do you become certified as trauma informed, or like, is it a training? Like, I guess I need a little bit more clarification on that.
Yeah. So that's a really good question. And I guess it depends. There are I have my opinion on it, and then I have there's what's available. So no, but if they're everything is interconnected, so there's no global certification on it because there's no board there's no board that's overseeing the practitioners in it.
Right.
But there are certification programs you can go through depending on the, what part of the trauma informed care, field you are sitting in. Like we were talking earlier about trauma informed yoga. That's probably has the most amount of certifications in it. But that's not a board isn't governing it. That's just based off of the provider.
Right.
And then there's SAMHSA, the Substance Abuse for Mental Health Services Association. Oh, I said it all in one sentence.
Good job.
That one's also a mouthful.
Yes, it is. It is.
They have some courses on it, but there's no certification. So that's probably the one that's going to just give you the most just nitty gritty, bare bones learning and development of the tenets of trauma informed care.
Mm-hmm.
So that's kind of the bare bones of it, and they've got really great options. They're run by the government, so they're funded through different grants through the government. So that's probably the best way to start to get a basic understanding of it.
Right.
So, and the other piece I should say about SAMHSA is it's going to come up later in our conversation, is there's 6 principles of it. And the first one is safety. Okay. So how can I develop safety in my organization and my spaces?
Okay.
The second one is transparency and trustworthiness. So how do I have these behaviors in my organization on the micro, meso, and macro level? So individual to personal is the human service provider way of saying that.
Right.
How can I develop trustworthiness, trustworthy practices, safety, trustworthy, and then it's collaboration and mutual support. I think those are 2 different ones. No, collaboration and empowerment. So it's how do we solve problems together?
Right.
So there's no hierarchy, right? No one. So, and the client is the expert on their own experience. That's the big one.
Wow.
So we're not looking at people through that sick lens. That's not what's wrong with you. It's what happened to you.
Oh yes. I was actually literally just thinking that because I saw the documentary by Gabor Mate, Wisdom of Trauma.
Woo.
And I mean, I think about it all the time. In the beginning, they show people's eyes and just looking at people and, seeing their pain and realizing that, if you look at people as more like what happened to you rather than what's wrong with you, that just is such a shift in your mind about it makes you look at people differently. It makes you treat people differently because our system wants to just think what's wrong with people, if there's a criminal, they don't think about what led them to that. You know what I mean? And the idea of trauma-informed care is is very comforting to me. Being introduced to trauma-informed yoga, it's funny. I don't know. I would have to do a lot of deep thinking as to why I'm like this, but if someone tells me to relax, I can.
Right.
But if people don't tell me to, I don't do it. And I'm okay, why do I feel like I need that permission? You know what I mean? But with trauma-informed yoga, being given the choice, do you want to do this or this? Maybe this will feel good. And the permission to just stay in a restful place the whole time, it was I don't know what this is, but I like it, and then I found myself when I was doing Pilates, which I had done for a long time, it was a pretty fast pace. And I'm wait, I want to slow down. And so tuning into your nervous system, most people don't know how to do that.
Right.
And so we're kind of just naturally talking about how it differs from traditional care. So, can you talk a little bit about how you think it differs?
Oh, yeah. So, usually in our society, we go to the doctor with a fixed mindset, or they are treating us with a fixed mindset. Something, even mental health is like this, my own experience is like that, but on a macro level, which would mean collective, we're lots of times we go to the doctor, we ask them, what's wrong with us? What's wrong with us? What's wrong with me? Fix it, fix the problem.
Right.
And probably most people that have gone through stuff or have autoimmune issues probably know there's lots of things they can't fix.
Right.
And so trauma-informed care is looking at, so that's kind of the traditional. So it's a fix, it's a come in, fix the problem, make it go away. Okay. Or then I go back. So they're looking more at symptomology. What's the symptom? Whereas in trauma-informed care and a lot of more holistic pieces, they're looking at how can we prevent getting there, or if we have gone there to we are traumatized, how can we prevent re-traumatization through those 6 principles that Samsa talked about, which I'm not sure if I got through those: safety, trustworthiness, empowerment, voice and choice, and diversity and inclusion matters. And so the framework is if we start to use those 6 principles, we are able to, the idea is that you can minimize harm.
Yeah.
Obviously you can't prevent harm because we're not God.
Right.
But the idea is minimize the harm of the re-traumatization in systems.
Well, it just seems more gentle and caring and person focused rather than like money or prescription focused. Do you know what I mean? Like, I know that a while back there was kind of a lot of controversy because grief was considered like a diagnosis and like, do you remember hearing that?
Yes, I do.
And
remember that.
I know it was very controversial because it's like, well, then that means it's almost like if there's a diagnosis, then maybe there's a pill for it, which is totally not probably good. Right. I mean, in some ways I can see because, for insurance reasons or whatever, that's about the only reason. But, to think that you can just give somebody a pill and then they're not going to be grieving anymore is unfortunately the mindset of our country, but it's not
the reality.
It's not going to solve anything. So that actually kind of leads me to like how is trauma-informed care helpful during grief and grieving experiences?
It's really interesting you say that because I was just writing the part of the grief portion of the course that we're talking on, that we're speaking on, or they were launching in at the end of June. It's called Reiki for Trauma and Grief Care. So this is just fresh on my mind.
Yay. Well, spill it. Let's hear it.
So, it's funny because they're they're interrelated, but they each have their own space and they each have their own process. So I always like to say that, but you can have traumatic grief, grief happens, as personally is, trauma can be, re-traumatization can be a secondary loss of grief. Right. Yes. And so, cause grief is like a big ball, much like complex trauma is a big ball of primary and secondary losses, but they're different. The losses can be different, but absolutely, they're definitely interrelated. And they both deserve their own space and their own perspective. But I think the biggest thing, I'm writing the trauma-informed Reiki course right now with my, trauma-informed Reiki and grief course right now with my Integrate coworker or colleague, Victoria Manuela, who's a trauma-informed death doula.
Wow.
Yeah.
Wow.
They're really cool. And they're in New York. They're amazing. And so Victoria and I have had like really sat through and looked at this very question. And, when we were putting this course together, I'm a Reiki professional, by the way, and a trauma-informed yoga teacher. So
we can talk about that too.
So I was just letting you know. So I'm speaking from that lens also as an instructional designer, but when we were putting that together, we were kind of looking at how do we bring these two pieces together. And I think the big thing is like with trauma-informed stuff, there's more like pragmatic practices we can do or we can move through that are a little bit more like there's EMDR. There's like things like not strategies, but like therapeutic models that you can like reach out to help you sort of minimize the activation of the trauma. Grief, not so much. Grief is more about space holding. It's more about digesting the emotion and less about so is trauma too, but grief really, that's the biggest difference is like, I can go find a trauma therapist who can help me with EMDR, somatic experiencing, all the yoga, Right. Grief is more like a little bit bigger ball of just digestion of experiences. Yeah. That's kind of what we were like discerning when we broke these two down.
Right.
And so with grief, what we realized, it's really about how the spaces that we can be in that can help us hold the grief and let people have their grief without fixing it.
Right. Oh, because that's another thing our society definitely wants to do is hurry up. And I've been caught in that myself because losing my son has been horrendously painful. And over time, I've tried various different things, and unfortunately, none of it takes it away. I've been caught multiple times by my therapist trying to just hurry up and come on, let's just do this and get it over with, and it's like, it doesn't work like that. And I've had to learn, in one of my other episodes, somebody was saying you have to feel it to heal it. Mm-hmm. And as much as I hate it, it's also true. And that's a kind of the dynamic I have with my therapist. Like he'll say something and I'm like, I don't like it. Right. But you're probably right. And I have to challenge him every once in a while because I'm like, it just takes me a little minute to, get through it. But I've learned that you do have to learn to sit in it. And that's hard.
Right. And the cool thing about the trauma-informed piece of grief work is that that I've learned from just different forms for somatic experiencing and just working with in Reiki and working with other trauma-informed colleagues is like you don't have to feel it all at once. Yeah. You can we call it titration in trauma-informed yoga. You can like titrate the emotion a little bit. You can be like, okay, I have the capacity to feel this much right now because it feels too much. Because if we feel too much, this is just my experience, but this is what I've heard from Reiki clients and other people. Definitely, this is my experience, but this isn't everyone's. But sometimes if we feel too much, it can override our nervous system and we can shut down. Go numb.
Oh, absolutely.
So that's where like the trauma-informed piece of grief stuff, this is where Victoria's work is so powerful, is it, we can kind of learn how to like put stuff, as my old therapist used to say, put it in a box. Yes. Take this one little feeling, focus on that one little feeling, and then put the rest in the box and we can pick it up later. And that also gives you agency that you don't have to feel all of it at one time, that you can just pick up the little pieces of grief.
Right.
Notice it, like kind of feel it. This is probably actually going into another modality that's really great from trauma-informed care that also overlaps to grief, which is somatic experiencing. It teaches you how to pick up emotions, pick up body sensations or experiences, follow it, notice where it feels in your body, and then slowly release it in your own time. I mean, if your body is ready to release it. Which is what's great about somatic experiencing.
Because sometimes it might not be ready to.
Right. Sometimes it's not ready to.
Wow.
And that's okay too.
Wow.
And that's probably the biggest practice that I have seen besides Reiki best overlaps with grief processing.
Wow.
Is somatic experiencing practitioners. And there's like a whole laundry list of them. You can find some in St. Louis. They're all over the place. But and sometimes they're not necessarily psychotherapists that do it. Like sometimes massage therapists are somatic experiencing professionals.
Wow.
And there's like a licensure you go through to go through it. But that's an amazing resource to have if you're dealing with that onslaught, that ball of traumatic grief is somatic experiencing. But they're the ones that can kind of teach you how to kind of take that big ball of experience and sort of titrate it into so you don't overwhelm the nervous system.
Wow. I really like that idea because I actually, so early on, my therapist said, exercise is like taking a 10 milligrams Zoloft. And I'm like, okay, I took that to heart because I'm like, it releases hormones. And, so at first I was doing a lot of, and I still do, that's just a preference. I like to do kind of like boot camp type things.
You're talking to someone in the boxes, by the way. Okay,
good. Well, that's probably another great one. I think I could probably strike some things and it might help. So the thought of the trauma-informed yoga was like a total shift for me because it was a lot slower and it just took me a couple weeks to really kind of I liked it right away, but it was just a very big shift in my mind. And, I was really enjoying the Shavasana at the end, in the restful position. And so I think it was like my third week and I was like, wow, I was having a really good day. And I remember saying, wow, this is a really good day. I can't wait for Shavasana. It's going to be so good, So I did my class, we were doing Shavasana and I couldn't relax.
Right.
I was like, what is going on? Like, I was like really kind of upset. And so I mentioned something to the teacher. I'm like, this is so strange. Like, I can't relax. And it was like, when I said it, all of a sudden these like feelings and emotions like came right to the surface, and I just started like bawling. And she was like, that was, your body just needed that release, you know? And I was like, oh my gosh, because I know I'm holding on to so much. I was a surrogate, and I delivered the baby on July 8th, and 6 days later, Jackson went to the hospital, and then he died 6 days later. So in 12 days, I gave birth to someone else's child and lost my own child. So it was like my body was holding on to so much, and I've been truly in survival mode. And it was like, I just kind of started thinking, I'm like, you know, I don't want to just live in survival mode. I want to help my body process some of that, because it was almost like my body looked and seemed pregnant still. Because I think it was like holding on so tight to something. And it was like trauma-informed yoga is helping me to be able to kind of release that. And I really probably need to do it all the time, because personally, I just need to relax a little bit more. I mean, it's a hard world that we're living in. There's just a lot of information coming at you at all times. And I just like find myself getting very overwhelmed, and I can only take in so much, you know?
Yeah.
That's definitely kind of a boundary thing that I've had to kind of learn. You know, I'm like, there's only so much I can take in with living with the trauma that I have, you know?
Yeah. Absolutely. That makes total sense.
Yeah. So talk a little bit more about like the Reiki and the trauma-informed yoga. Like, are those things that you can do together? Or are they more separate?
Rachel does it together.
She does it. She does?
Yeah, Rachel.
Hi, Rachel McConville.
Yeah. My friend Rachel McConville is a trauma-informed yoga teacher at Joy of Yoga, where I teach and yoga at. And Rachel McConville and I both. She has a class on Monday nights, which I'm subbing through June, where she does Reiki and restorative yoga together, and it's from a trauma-informed lens. So we kind of have wrote like a whole principles of trauma for that studio, for the way that she and I and a couple other teachers teach over there. So so it's you can do them together, you know, but they're generally speaking, like, they're two different traditions, two different, you know, practices. One is energy and one is, I mean, I guess yoga's energy too.
Right, right.
But one's more like body, one's more like moving your body, and one is more about like being a conduit of energy, flow. So, but yeah, trauma-informed yoga, which we've been talking about, I'll start there since that's where we are. So trauma-informed yoga is kind of based off this premise of we're looking at, traditionally, yoga is it has been about, you know, being fit, and like the way that it's been like sort of colonized here in the States. And you know, it's all about like, you know, how you look in a shape, how you look in a, you know, how are you, it's all about the teacher, what the teacher says to you. So it kind of goes back to the hierarchy, right? So trauma-informed yoga then looks at that and says, what if we take the hierarchy away and we let you be the author of your own experience? Okay. And the teacher is just there to facilitate the space and just give you options, but you're in charge of your own experience.
Wow.
Okay. So that's the big shift. So in like other classes, I think they all should be trauma-informed. I think it's kind of ridiculous that they're considered two different things.
Right.
It's like, that's what, I mean, people at Joy of Yoga hear me talk about that all the time. I'm always like, I don't understand why it has to have a special space for it.
Right,
anyway, it should all be like this.
Exactly. Yeah.
And so anyway, that's my like tirade. That's my soapbox that I'll just, the hill that I'm going to stand, that I'm going to die on. Anyway, but generally speaking, so if someone is coming from a trauma or has had training in a trauma-informed certification, which I can list off some reputable ones, because there are some non-reputable ones. But anyway, they're generally looking at how giving you your own experience, letting you make choices, like doing Shavasana, you know, the whole time if you want to, just holding space for people. Another component of trauma-informed yoga is, you know, is really, it's obviously freedom to make an empowered choice for yourself, but it's also the nervous system, learning how your nervous system responses to certain shapes. Okay. So like, I know, because I teach a lot of yin and like hatha yoga, Like for me, like I knowing kind of my relationship with the nervous system and my activation levels and my drop off levels and my shutdown levels. It's called polyvagal theory, or the window of tolerance, if you're familiar with that.
A little bit, yes.
So the whole concept is like, you kind of are like, it's all energy. Like, how am I responding to the stress response? I'm either super anxious or I'm shut down. And what we're trying to do in Trauma Informed Yoga is we're trying to wedge this space between where we're able, it's called the window of tolerance. And I mean that in a very, that's what it's called. I call it the window of compassion, because tolerance sounds like you're like, how regulated can I get so I can tolerate abuse? And that's why I just put that little asterisk on there. That's what it's called by professionally, but I reframe it for trauma survivors, or if I'm just talking to the general public, because it's really about creating a compassionate space for yourself within yourself.
Right.
And so Trauma Informed Yoga is looking at how can it create that space for you to, it's inner peace, essentially. Wedge a space where you can feel a little bit, a sense of not inner peace or inner calm, but I call it like acceptance or clarity. So, because you can still feel really crappy and grieving and be totally clear about it. Yeah. Okay. So I always have to say that it's not about feeling good. It's not about being in a space of happenstance. It's about really just being able to feel clear about what's happening within you. That's really what it is. Yeah. And so Trauma Informed Yoga is that space for you to kind of, I call it churn what's happening a little bit, kind of see what's happening within you, in a space, but contained by with an empathic witness. Because what happens a lot with trauma and in grief is we're left alone with it. We're left alone with our grief. Yes. We're left alone with our trauma. I mean, attachment wounds. Right. I mean, lots of times we have attachment wounds because we are left alone with our pain for so long as children. That was my experience, And so Trauma Informed Yoga is great is because we have that space where a teacher is holding compassionate space, where that empathic witness, this is what Gabor Mate talks about in his thing. So you have that compassionate witness watching your experience, but you're still having the experience and they're not entering into it. Isn't that cool? Yeah.
And holding space is something that, I have one friend who says that a lot. And I remember I liked how it felt, but I didn't always know what that meant. So how would you define holding space?
That's really great, because that's actually what I just read about with our Reiki course is how do you hold space for that? Right. We kind of break down the construct of that. But holding space is really creating a container, as we say in Trauma Informed. Think it's anytime you were in space, there's a container. Like there's a container between you and I. There's a container when you're in a Trauma Informed yoga class or any yoga class, and it's up to the facilitator to make it quote unquote, I'm not going to say a safe space, because it's not up to them. It's up to the survivor to decide if it's safe or not. Right. But to make it, to make it to minimize harm as much as possible. That is their job. And that's where that framework of Trauma Informed Yoga comes in, right? Right. Trauma Informed Care comes in. And so if you're following those principles, let's say, ideally, this is a very generalized statement, but how are you making it a safe place? Are you showing them where the entrances are and where the exits are, where the bathrooms are, so they're not searching around, Are you being trustworthy? Are you, showing up when you're saying you're showing up? Are you following up with emails, and all the other principles. So that's kind of the way that you kind of can help build the fruit of the space, and the boundaries around it. So that's kind of this concept of it, of creating that space, and then also knowing what's yours and what's the yoga students or the Reiki for Reiki that can get funky.
I was just going to ask you about that. Yeah.
That gets funky with Reiki, which is why we have this course. There's a story behind that.
Okay.
There's a story. I had a new practitioner that really projected, which just means she put her own stuff onto me, and it really re-traumatized me. And anyway, and now we have and I'm an instructional designer, so now we have a course.
Yes, well, that's good, because that's needed. Right, it's for sure needed.
So that's what happens. That's how we make meaning out of our pain. Yes. I was like, well, I know how to train on these things. I work in L&D. Yeah. So Reiki gets a little more challenging because we have people that really want to help other people. And yogas, they actually have the same problem. Let me be honest. I was like, it's actually a lot of the same problem. Right. There just isn't as much around Reiki. There aren't as many trauma-informed Reiki resources as there are trauma-informed yoga right now. Okay. So that's our big problem that we have. Right. It's a lot more. Anyway, so with Reiki, if anyone's familiar with Reiki is a Japanese they would call it energy therapy, but I use therapy sparingly because it's not therapy. In a Western world, it's a complementary form to therapy, but and trying not to like colonize it. Some traditions do see it as therapy, but it is definitely not from a Western standpoint, or one I would say where you can deal with all of your stuff, and it's not therapy.
So it's not a replacement.
No,
for
it's
therapy.
not a replacement for therapy.
It's something you would do maybe in addition to
therapy. And that's the lens that me and Victoria present it as. Okay.
Right,
And the way we do it at Joy of Yoga too, because
Right.
there's a whole Reiki room downstairs, several of them actually.
Right.
And so with Reiki, it gets a little funky because sometimes because it's not, none of it's regulated, but sometimes you get people, the training is you can go through it in 3 months, maybe 6 months, right? And it's like 1, 2, 3, it's like maybe 8 hours per session. There's 3 levels of it. And everyone can train differently. There's like a basic, very loose framework with how you train on it. So, and from what I looked at when I was looking at this, there's almost no conversation about about the complexities of trauma, of grief, of how to bring a little bit of psychoeducation into the practitioners that are out there. So as someone who does what I do and how I do in the world, I went through my Reiki certification a while ago. And, there was just a lot of red flags and things. So where we see a lot of red flags are people tend to do counter projections. There tends to, and the people that I have trained or have come to my own Reiki shares that are online, they tend to, they ask a lot of questions like, how do I make this safer for someone? And, lots of what they end up finding into is that it's that fixing piece. It's that holding space piece. That when you hold space, if you're a space holder, which most yoga people and Reiki practitioners are, it's not your job to decide how someone experiences the space. You have to just hold those practices, those tenets of trauma-informed care. And there's some tenets of grief-informed care as well that are a little bit different,
right?
But they're all in the same thing. And it's your job to hold that. But you can't change or fix the experience, and you can't information dump. And what happens is lots of times a lot of new healers will like do Reiki on people, and they'll find there's a little bit of intuition work in there, and they don't know what's theirs and what's someone else's, and there's lack of discernment, and they'll say something. Sometimes they won't know what's the difference between Reiki or maybe they say mediumship practice, so, and those are 2 different energies and 2 different things, so just there's that lack of understanding from the people that we have worked with that seem to not understand that discernment. And so the training that me and Victoria put together is, okay, how we need to build that discernment within. We need to build the frameworks of how do we hold the tenets of trauma-informed care and hold that compassionate space where we're letting someone else's experience take up the room. This is what we do in psychotherapy, right? Mm-hmm. The therapist lets your experience take up the whole room, right. And in Reiki, it's even more like that because you're not a therapist. You are just a conduit of energy. You're like, me and Rachel McConville, who's also a Reiki professional with me, we also say you're like a hose, right? And all you're doing is flowing Reiki in there, and you're helping your practitioner build that relationship with Reiki within themselves. Wow. Okay, with that energy. Right. That's all you're doing, and you're not like healing someone. You are literally just a hose. Right.
So, would you recommend that someone who is going to have Reiki, would you recommend someone who is trauma-informed?
Yes, there's not a lot of those right now.
Okay, but you're working on
We're building it.
Okay.
There's probably like me and Rachel. There's probably like a handful of others. Like
right.
I know those are the 2 in St. Louis. I would say me or Rachel or Alicia Delaney are both 2 people you could go to here in St. Louis that I know for sure. Sure. That have the skill set to do that. So we're all over at Joy of Yoga, but that have that understanding of how to do it. But Rachel for sure. So.
Wow. So the holding space, is that something you learn how to do?
We're teaching it.
Okay.
and the course we're launching on June 22nd. We're teaching how to we're bringing in mindfulness techniques. Because it's really how do you teach someone how to, that was my thing as an instructional designer. You're always looking at what's the gap. And I was like, what's the gap of holding space? Where's the performance gap?
Right, right.
And so it was a little bit of something to try to do. So we brought in mindfulness techniques. So that help build discernment, because that is what we do to help build discernment within, and yoga is full of them. And when you could go become a yoga teacher, generally speaking, they're teaching you that internal discernment. Now, how many people latch onto that, I don't know. It depends on your training. But most of my training, specifically my trauma-informed yoga training, definitely went through that discernment of space, what's mine, what's my students, and understanding like doing your work on your end. So you're constantly going to therapy. You're never not working. The work is never done. You're always a progress, especially if you're holding space for other people. So you minimize harm, because that's one of our tenets of responsibility is like, how do you know what your stuff is if you're just going non-purposefully, kind of just in default mode? That will increase harm for someone else that's coming to you to hold space, right? So the way that we teach it is like I bring in like the THINK acronym. Remember, and that's in elementary schools, and I think it's a part of like some mindfulness, like Buddhist philosophy. But it's the what is it? Is it kind? Is it necessary? Is it truthful? It's that acronym. We use it in elementary schools all the time, and the trauma-informed yoga programs that I helped run in the school system. We always brought the THINK acronym in. So THINK is one. RAIN is another one. RAIN is I always forgot who the original author is. It Tara Brach is the one that's the most. She uses it the most in her. She's a Buddhist psychologist who's awesome. She's got a great podcast.
Wow. And
meditation. But RAIN is recognize, allow, investigate, nurture, or nourish, one of the two.
Okay.
And so those are kind of your ways of dealing with like discernment within. It's kind of like our acronyms for how can we deal with confusing things in front of us that we don't know about. And we can do, as Tara says, make that U-turn, right? So we can kind of go from like for example, in Reiki, lots of times where people get stuck is I saw like someone else's past life, or I saw this. Can I tell them? Or I saw someone's trauma. Can I tell them that? And like that, there's no like one answer for that, but like all it comes back to is a relationship, and you have to determine the relationship. By all means, if that's a new client, no,
right.
Nobody wants to hear you just blah, your stuff, because you know what? It could be your stuff. You don't know if that's a projection. You don't know, you don't know.
You can see again where that discernment piece is so important.
Yeah. And so doing those, that's where seeing a therapist or seeing a coach or, having your own space for you to kind of determine that stuff,
right,
really makes a difference. Because if your stuff comes out, and in Reiki, if it doesn't, if it won't with one person, it will with another.
Right.
You don't know. And it's hard because you have to build that discernment. What's my energy? What's my relationship with Reiki in my body? And what's the other person's energy like?
Right.
And you have to sit in your own energy for quite some time to be able to at least build that up a little bit, and doing Reiki on yourself, on your own, those are all ways that you can help build that discernment. So I guess the straight up answer is like that mindfulness practices, those simple practices that help you kind of chunk out your own confusing moments. Or, like we say in, trauma-informed Reiki is like, if you question it, just don't say it. Like, it's okay.
Right.
And is it yours to say? There will be more harm probably by you saying something than not saying something,
right.
Especially if it's new or someone, and most people in the Midwest are still kind of warming up to Reiki. So like, unless you like want to scare someone out of the bejesus out of them, like, just it's okay to not say something.
Right. Right. Yeah. That's a beautiful thing. Sometimes
containment is real. Like I was even thinking about that this morning. I was thinking about a situation. I was like, should I say this? Should I not? And I was like, the practice of containment is so beautiful. We talk about that in yoga a lot.
Right.
Learning to just be like, that is not mine to fix.
Right. And I think sometimes that anytime you question it too, it's kind of like, is that my gut telling me that I probably shouldn't say it? You know what I mean? Like I definitely am so much more in tune to my gut than I ever have been. Intuition, however you want to call it. You had talked a little bit about trauma-informed yoga or care in schools. Is that something that people do around here?
Yeah, it does. Yes. Yes.
I'm thinking of like, just with all the trauma that the kids have been living in with COVID and then school shootings and things like that, like how can that be integrated?
Yeah. So a lot of the schools, like back in when Ferguson, that's when I started getting into that whole movement. I was deeply involved in it for about 6 or 7 years. And me and Natasha Bailey had a whole school funded trauma-informed yoga program until COVID hit. But it's the trauma-informed schools movement here is really big and it's huge. I think it's it should get bigger. It should get more funding, especially now. I mean, it should never not be relevant.
Yes, absolutely.
But yeah, so at one point in time in St. Louis, I don't know if they're still around. I've been a little bit off of the radar with them, but Alive and Well Communities was doing a lot of training on the basic tenets of trauma-informed care for schools and organizations, but they were big in that movement. So they're called Alive and Well Communities. I think they're still around, but a lot of the schools themselves have like a, like I know where my kids were in school, Maplewood, they had like a, I think they ended up having like a social emotional teacher, now for kids. My daughter was in that for a while. And so things like that are starting to like pop up. And now more so, I think now we're seeing more and more of that now with COVID and shootings and like, God, it's like, how can we not need it anymore?
Absolutely. It's very needed.
And so, yeah, so there's been a lot of legislation around it locally. So yeah, St. Louis is actually really, I wouldn't say we're like amazing at it, but we're not like, oh, we should have this. We've been doing it for almost a decade.
Okay.
It needs more funding.
Where does that funding come from?
Usually the state. The state has actually
like Department of Mental Health?
DESE.
Oh, really? Mm-hmm. Oh, wow.
DESE has trauma-informed, shockingly, I can't even believe I'm saying this, but like sometimes they, when they're doing it really well, they're like, if there's a huge need, they'll be like, yeah, we need to do that.
Right.
Shockingly.
Right.
But it has to be bleeding before they see it.
Of course. Yes.
So,
oh, gosh.
So they have, like DESE has trauma-informed care trainings on there for teachers, but like they're not mandated. That's where they need to like, and I think teachers right now obviously are like hugely, I'm an instructional coach. So like they're really traumatized right now. So, teachers aren't really great at taking in new information around trauma right now.
Sure,
so they're just dripping in it at this point in time. But
yeah.
But there is a lot of advocacy around it right now, especially with school shootings. I think one way that we could do it in St. Louis, I was like, if we could ever like, gun control is absolutely 100%. We need to be talking about that, but this needs to be a corner of us that are talking about the mental health of kids through this. And I feel like we've kind of like gone dark on that because the gun control stuff is so important.
Well, and there's this idea, I talk about this a lot. I have a shirt that says Children's Mental Health Matters. Mm-hmm. I feel so strongly about it, especially related to child death and sibling death, because people say, oh, they're young, they're resilient, they'll be fine. And I just can't stand that anymore. It's like, no, these kids need help. We need to help them through this kind of stuff because, we all know kind of what happens when people don't address those issues later on in life. They become alcoholics or drug addicts or have all this trauma. And it's like, with my son, I got him into play therapy about 2 months after Jackson died. And in fact, we have an appointment later today because he's just having a lot going on. Sure. And I don't really know always how to help him, and he has been extremely traumatized by everything. And I don't have any control over what happens to him when he becomes an adult. But what I can do is help him and give him all the tools possible considering the trauma that he has lived through. And, his development has not stopped. He's a happy, thriving child. Now, don't get me wrong. He absolutely still has anxiety. And, so there's but for me, I've learned so much about the things that are available, like the trauma-informed yoga for kids, EMDR, all that kind of stuff. And so it's like, for me, being aware of it, which is part of what I do with this podcast, is letting people know about what's available because, a kid's not going to just sit on a couch and tell you all about their feelings. They have to have those different modalities and the space to be able to share it. I've seen some absolutely beautiful moments with my son and his play therapist, just face to face and just kind of locked in with each other. And, it's coming from someone besides me. And they just have such a love and respect for each other, but she's done such a good job at, creating that relationship with him. So I've definitely seen it myself and want to do like anything I can to help get those kind of things in schools. And it's just so needed,
Absolutely. Absolutely.
So kind of to wrap it up, would you tell me what you want people to know about trauma-informed care?
So I think the biggest thing about trauma-informed care is that, it's a space. Trauma-informed care is a system of not a hierarchy where you are the kind of not master. You're the master of your own experiences, and that you're in charge of, and that it's a system that breeds self-trust.
Yeah.
Right. We have a system. The way our society is built up is we are built to trust other people. I mean, not that you shouldn't look to authorities in their profession. I mean, trust me, that's absolutely necessary.
Sure.
Like therapists, for example, or yoga people.
Right.
But at the end, those people should also trust that you know what you need too. And that's the biggest thing of trauma, is that when trauma or grief, because this is where they're a lot of the same, is there's a lot of like dismissing of the experience, or in the way our society deals with it. And so when in trauma-informed and in grief-informed care, we're saying you're in charge of your experience and you get to tell us what is it that you need. Okay. Right. And that's just so radical in the world we're in right now.
Yes.
Like I was even just thinking about that today, because when Integrate started almost 8.5 years ago, wow. It seemed a little bit less radical. Like, oh, of course this is what should happen. Right. And now in recent legislation, I'm like, oh, it's like so radical to like have body autonomy and emotional autonomy. What a concept. Now it's become super radical again.
Right.
But also timely. And so now I'm like, that's my answer, is it's a space for you to practice agency, to practice self-trust, to build the cultivation of self-trust, because I know that's like a lifelong thing.
Right.
So that's really what is it. So it's a system of care with these 6 paradigms that help. That the mirror is, the basic tenet is that you need the building of trusting yourself to make decisions for your best, highest and best good.
Yeah. And honestly, just the way you explain it is like peaceful to me. Yeah. You know what I mean? Like, just being reminded that, no, you can make those decisions for yourself. And so the way I end every episode is my favorite Maya Angelou quote, which is, we do the best we can until we know better. And then when we know better, we do better.
Yeah.
And so that it's just miraculously fit in absolutely every single episode. So I believe that people probably learned a lot today about trauma-informed care and how you can have that for yourself, and also some beautiful healing modalities that hopefully I will be partaking in with Rachel.
Yeah, absolutely.
Yeah, so thank you so much. This was as I knew it would be, very, very helpful and informative. So
absolutely, thank you. It was a wonderful experience.
Thank you.
Thank you.
We are beautiful miracles. We are